Cystic Fibrosis by Amanda Grunstaff. Cystic fibrosis is a multi-symptom genetic disorder that is manifested by chronic obstructive pulmonary disease, GI disturbances, and exocrine dysfunction. Cystic fibrosis is also referred to as CF. CF affects the body's cells, tissues, and glands that produce mucus and sweat. Patients with CF make thick mucus that is very sticky. This thick mucus causes blockages that affects the organs and then can also cause major infection. CF can cause inflammation that leads to damage to the lungs and the pancreas. It can also cause a delay in growth due to the patient being unable to absorb nutrients as they should. Incident rates for cystic fibrosis are 1 in 3,000 white births, 1 in 15,000 African Americans, 1 in 13,500 Hispanics, and 1 in 35,000 Asian descents. There is currently no cure for cystic fibrosis. There are several treatment options available. Morbidity and mortality rates have decreased due to the newer treatment options. Patients with pulmonary disease are at the highest risk for morbidity and mortality. The predicted lifespan as of 2014 was 39.3 years, according to the Cystic Fibrosis Foundation. Currently, the lifespan for an individual that has cystic fibrosis is 41.1 years. This number has increased due to newer therapies that target the genetic defects that may further increase the lifespan of the patient. High-risk populations for cystic fibrosis are 1 or more parents that are carriers of the gene, a sibling or first cousin with the disease. More are at risk if they are of the Caucasian descent. Cystic fibrosis is an autosomal recessive disorder. It involves the mutation of cystic fibrosis transmembrane conductance regulator protein, also known as CFTR. The gene of cystic fibrosis is found on chromosome number 7. CFTR functions in sodium transport. It regulates triphosphate channels and involves bicarbonate chloride exchange. Defects of CFTR are that it causes defective ion transport, airway surface liquid depletion, and defective mucociliary clearance. Depletion of phenylalanine in position 508 results in mucus obstruction. This causes severe inflammation and can result in infection. Failure to conduct ions across the epithelial cells leads to problems and complications within the lungs, the pancreas, the GI tract, and the sweat glands. Mucus thickening targets the lungs and the exocrine gland. The patient then has a depletion of air, which makes it harder for them to breathe. Viscid secretions within the pancreas, liver, and GI tract can cause further complications that cause the patient to have a decrease in the absorption of most fats and proteins. This can lead to malnutrition and weight loss. A list of signs and symptoms for a patient with cystic fibrosis may be a cough with wheezing. They may have mucus or blood with their cough. An infant may have a blockage of its intestines. A patient may have clubbed fingers and toes. This could be due to the lack of oxygenation. Patients may have fever along with night sweats. An infant may have a prolonged incidence of jaundice. Patients could have muscle and joint pain, delayed growth, and or delayed puberty. Patients may have salty skin and recurrent sinus infections. A diagnostic evaluation for cystic fibrosis may be done simply on signs and symptoms that the patient is having. It is important to obtain a family history along with signs and symptoms. The family history could be a good indicator that you might need to further test your patient. One diagnostic study used to diagnose cystic fibrosis is a sweat chloride test. Levels of 60 or greater than 60 indicate a true diagnosis of cystic fibrosis. Levels of 30 to 59 may need further testing. Levels less than 30, there is no indication of a diagnosis for cystic fibrosis. Genetic testing is often done. This can be done on newborns, and this will be a definitive way to diagnose cystic fibrosis of the newborn. Prenatal testing can also be done now. They can take samples of amniotic fluid and the placenta and test those for cystic fibrosis. Cystic fibrosis can cause many psychosocial issues. The disease impacts the lives of these patients in several different ways, and they all have different ways of dealing with these issues. Many patients with cystic fibrosis suffer from anxiety and depression. They deal with the constant stress of dealing with strict treatment regimens and therapy that can take up most of their day. They have an increased stress from having to maintain a strict diet that is filled with high fats and lots of calories in order for them to not lose weight. They are stressed to stay as healthy as possible by constantly having to avoid germs. This can make it hard for them to be in public places and for them to enjoy themselves. Once these patients reach the adolescent stage, they will have more problems with anxiety and depression for the fact that they cannot live the same lifestyle as their peers and that they want to feel more normal. The disease can cause major stress for the patient's families as well. It impacts the caregivers' lives just as it does the patient. Most parents will have to quit their job in order to stay home, or they will have to pay large amounts of money for a caregiver, which could lead to a financial burden. They have to constantly be on top of treatment regimens for these patients and ensure that they receive their medications on time. They constantly are having to ensure that the patient gets the therapy they need and that therapies help to maintain a clear airway. If the patient's parent has a job, they eventually will probably lose the job due to missing days of having to be in the hospital with their child. Parents of children with cystic fibrosis may also have a lack of socialization, which could lead them into a major state of anxiety and/or depression. What are some of the ways that cystic fibrosis is managed? The goal of treatment for cystic fibrosis is to optimize lung functioning, prevent further disease, and to avoid further complications. To manage the pulmonary system, you will need removal of secretions with hypertonic saline, postural drainage, percussion, positive expiratory pressure, exercise, vest treatments at least 2 times a day. High-dose ibuprofen is often ordered for these patients, but not used as often in children due to the high risk of GI bleeding. Azithromycin is often ordered 3 times a week. Chest x-rays are done quite often to indicate a pneumothorax, and lung transplants are an option for patients with long terminal lung disease. Many of these patients that have terminal lung disease have to be on a lung transplant list, which could take up to 2 years for them to actually get a lung. Patients that have pulmonary complications do also need to have a pulmonologist that they follow up with. Gastrointestinal disorders for cystic fibrosis patients are common, and we treat many of these gastrointestinal disorders through the GI specialist. So these patients will need to have a GI doctor that they follow with. Many of them will need enzyme replacements. These are generally the patients that have failure to thrive because they're not able to follow a high fat and high caloric diet. High dose lipase can be given for patients that are at risk for recurrent pancreatitis. Many cystic fibrosis patients have vitamin deficiencies, so they'll need vitamin A, D, E, and K replacements. Some of these patients have liver disease, and they are treated with ursodeoxycholic acid. Many of them struggle with bowel obstructions at times and will need osmotic laxatives and or enemas to help relieve those. These patients also will need an endocrinologist to follow up with. Many of your cystic fibrosis patients will become diabetic as they get a little older. They will need to have an oral glucose tolerance test generally around the age of 10. And this will determine whether they have cystic fibrosis diabetes or not. And these patients are treated with insulin just as other diabetics are treated, and that their insulin regimen can be ordered by their endocrinologist. And often you'll see these patients have insulin pumps just like type 1 diabetics do. So what is the nurse practitioner's role for a patient with cystic fibrosis within the pediatric population? Most of these parents will be managed by physicians at a cystic fibrosis accredited center. They will need to see pulmonologists and other specialists. The nurse practitioner may be able to help to manage their medications and order diagnostic testing when the patient is unable to see their specialist. They can order diagnostic testings for patients that are having initial signs and symptoms to help to get an initial diagnosis for their disease. They can make referrals to their specialists, and they can frequently monitor the patients for weight loss, anxiety, and depression. There are many websites and support groups to refer patients and families to. Some examples are the Cystic Fibrosis Foundation. This is a good educational online website. It has lots of information on cystic fibrosis and helps to raise money for the research of cystic fibrosis. The Cystic Fibrosis Research website also has a lot of good information. It helps raise money towards finding a cure for cystic fibrosis. This website has the most up-to-date research reports on new evidence for the cure of CF. Many of your adolescent patients and even parents of children that have cystic fibrosis can be referred to your local mental health facilities. These facilities can help them when they are struggling with anxiety or depression, and even help them when they're having social issues. These facilities have many options for inpatient and outpatient therapy to help them, and it helps them to cope with everyday life. There's also a Facebook page that I found that's called the Cystic Fibrosis Support Group. I think this would be a great website for parents who have children that have cystic fibrosis because it can help them to socialize with others that are in the same situation as them. Some questions to answer and think about for this week's presentation are: number 1, the parent of a newborn infant states to you, she thinks her baby may have cystic fibrosis because her neighbor's cousin has it and she just knows that her baby has it too. What kind of education would you give to this mother? Number 2, you're seeing a 15-year-old patient in your office with a history of cystic fibrosis. She states to you, I hate having this disease and sometimes I just wish I would die. I have nothing left to live for. What would you do to help this patient? do you consider this patient to be an emergency? And number 3, do you think that having a child with cystic fibrosis would be a life changer? Discuss how you, the nurse practitioner, could help a family struggling to deal with a child that has a long-term illness like cystic fibrosis. Thank you for watching my presentation.